When we start talking about how financial data impacts clinical results, we got to be very careful about what we promise and what we deliver and how those come together as an organization. The reality is that many healthcare organizations are driven by doctors and medical professionals that focus very much on service and outcome from a clinical perspective with very little education around financial information. Now, this isn't a problem in the sense that we want our doctors and medical professionals to focus on us as patients and focus on what is best, the best result for the patients in general. And we don't want them to really consider the financial side of the house because they're here to do good. And that is the real doctrine of the clinical professional. However, it is impactful for organizations to know that the financial data can actually impact the results of the clinical operations. But I don't want to oversell this, but it will tell us if the equipment that we're using is operating efficiently and effectively based on repair and maintenance. Additionally, financial data can highlight the variation between providers and provider coverage when it comes to private healthcare. We can look at it from a resource allocation perspective, how many nurses to doctors are in certain departments, and that shows profitability. But also, if we take clients or patients served within that data set and create dashboards there. This is where financial information really does start to marry up with that clinical information to provide some guiding aspects of it. But when I talk through this, I really want to make sure that we're clear that it is do good first, meaning the clinical operations, the doctor operations are first, but how do we as a finance operation support those program managers, those department heads, and being able to make decisions that don't have negative impacts on patients while having positive impacts on the bottom line? Because at the same time, we have to stay open, we have to operate, and we have to be able to be a going concern as a healthcare organization.